Hi, hello everyone. So today in this class, let's discuss about pharmacotherapy of oncology. So pharmacotherapy of oncology means nothing but oncology is the science which deals with cancer. So today we are going to deal about pharmacotherapy of cancer. So in this class, let's discuss about pharmacotherapy of means the principles of cancer, and then what are the agents, chemotherapy agents which are used in cancer. And in the next class, we will deal about specific types of cancers pharmacotherapy. So the first thing, basic principles of chemotherapy. So basic principles of chemotherapy involves different principles. In that, the first one is diagnosis and staging. So diagnosis and staging involves three things, that is accurate diagnosis, staging, and grading. So accurate diagnosis means nothing but it involves biopsy and histopathological examination. Biopsy means nothing but it is a medical procedure in which a small sample of cancer cell is taken from the body for the examination. So small cell is taken for examination of cancer. And next, histopathological examination is nothing but it is a microscopic examination of tissues in order to study the manifestation of a disease. So that is histopathological examination. And the next one is staging. Staging means nothing but we have to know about how much extent the disease has been spread in the body. For that, we will study the systems like TNM in cancer. TNM means nothing but tumor, node, and metastasis of cancer. And the next thing is grading. Grading is nothing but giving some grade, assessing some grade to the tumor based on the aggressiveness of the tumor. So this is the first principle, that is diagnosis and staging. The second principle is treatment modalities. So treatment modalities means nothing but so for which type of treatment we are using. So that comes under treatment modalities. In that, the first one is surgery. Surgery is nothing but it is used to remove the specific tumors of cancer. So removing process is called as surgery. It can be curative, it can be debulking, and it can be palliative. So curative means which cures, and debulking is nothing but it removes as much tumor as possible and it reduces the size of tumor. So that is called as debulking. And palliative care is nothing but it is the care which is given after surgery. So this is about surgery. Next one is radiation therapy. So radiation therapy is done by using high energy rays, and these rays will kill the cancer cells. And the next one is chemotherapy. Chemotherapy, in the name itself, it is there. Chemical therapy means nothing but giving therapy by providing some chemical agents, by giving some pharmaceutical agents, by providing therapy is called as chemotherapy. Next, hormonal therapy. Hormonal therapy, in the name itself, it is there. These are used mainly for blocking some hormone sensitive cancers like breast cancer and prostate cancer. Next one is targeted therapy. These targeted therapy mainly targets specific molecular pathways. For example, HER2 in breast cancer. It targets HER2 in breast cancer so that it can be removed. Next one is immunotherapy. Immunotherapy, in the name itself, it is given immuno means which boost the body's immune system for recognizing and fighting and destroying the cancer cells. And the last one is stem cell transplant. It is mainly used in blood cancer for transplanting the stem cells, for taking out the old stem cells, cancer stem cells, and placing new stem cells is called as stem cell transplantation. Next, the third principle is individual treatment. In the name itself, it is the individualized treatment, means the treatment is mainly based on the patient's genetic profile, patient's age, general health, and tumor characteristics. Personalized medicine is given to the patient. And the next one is multidisciplinary approach, means which uses multiple models and multiple mechanisms, which involves oncologist, surgeons, radiologist, pathologist, nurses, and also psychologist. And the next one is monitoring and evaluation. Monitoring and evaluation is nothing but the regularly patient should be evaluated and monitored with imaging, tumor markers, and by using lab tests so that we can get a good control over the cancer. Next one is supportive and palliative care. So supportive and palliative care, the supportive care is also highly necessary for the cancer patient. So it addresses the pain, nausea, fatigue, emotional distress, and nutritional needs of the patient. This care is highly essential for cancer patients, and it mainly focuses on quality of life of advanced cancer stage patients. And the next principle is prevention and early detection. So by doing some lifestyle modifications, we can prevent cancer like taking vaccinations of HPV and hepatitis B and doing some screening programs for pap smear and mammography. You know, the breast cancer can be detected in the earlier stages. If it is detected in the earlier stages, and it can be treated very easily. So these are about the basic principles which are used in chemotherapy. Next one, the general introduction to cancer chemotherapeutic agents. General introduction cancer chemotherapeutic agents means nothing but chemotherapeutic agents are the drugs which are used to destroy or inhibit the growth of cancer cells. The purpose of chemotherapy is mainly four things. That is, the first one is curative. Curative means nothing but to eliminate the cancer. Next one is adjuvant. Adjuvant means these are given after surgery. Given after the surgery or radiotherapy for destroying the cancer cells. Next, neoadjuvant. Neo means before. Before going to surgery, some agents will be given for shrinking, for reducing tumors. And palliative. Palliative means it is given after to relieve the symptoms and prolong the life in advanced cancer stage patients. And main key characteristics of chemotherapeutic agents involves three things, that is non-selective, systemic, and cell cycle specificity. Non-selective means nothing but these are not selective. That means they can kill cancer cells as well as normal cells also, like bone marrow and gastrointestinal lining. And next one is systemic action. Some chemotherapeutic agents, they reach cancer cells through the body via bloodstream. Next one, cell cycle specificity means some drugs act at specific phases of cell cycle only. For example, S phase of cell cycle or M phase of cell cycle, and while others are totally non-specific. So these are the key characteristics of chemotherapeutic agents. The classification of chemotherapeutic agents, these are the main classes of chemotherapeutic agents which are used. The first one is alkylating agents. These alkylating agents mainly adds alkyl groups to the DNA so that the DNA, when the alkyl groups are added to the DNA, these will inhibit replication and transcription process of DNA in the cancer cells so that the drugs are cell cycle non-specific, and examples of these drugs include cyclophosphamide, chlorambucil, and busulfan. Next one is anti-metabolites. These anti-metabolites will also interfere with the DNA and RNA synthesis. Examples include methotrexate, 5-fluorouracil, cytarabine. Next, plant alkaloids. Plant alkaloids mainly inhibits the cell division. It will inhibit the cell division, and they are mainly cell cycle specific. Like they are involved only in the M phase of cell cycle. Examples include vincristine, vinblastine, and paclitaxel. Next, anti-tumor antibiotics. Anti-tumor antibiotics are the natural products. They will inhibit mainly topoisomerase 2 enzyme, so that when it inhibits topoisomerase 2 enzyme, they will generate some free radicals which will damage the DNA of cancer cells. Examples include doxorubicin, daunorubicin, and bleomycin. Next, topoisomerase inhibitors. In the name itself, it is there clearly. Topoisomerase inhibitors. They will inhibit topoisomerase enzyme which are essential for uncoiling the DNA. The examples include etoposide and irinotecan. Next one is hormonal agents. Hormonal agents are used mainly in hormone sensitive cancers for blocking the hormone receptors so that it will suppress the hormone production. For example, tamoxifen, letrozole, and flutamide are used as an hormonal agents in cancer therapy. Next, targeted therapy. Targeted therapy, in the name itself, it is there. They will target specific molecular abnormalities which are present in cancer cells, so that then they are usually less toxic, and they will break they are very less toxic to the normal tissues. For instance, example, imitinib and trastuzumab is used as a targeted therapy. Next, immunotherapeutic agents. Immunotherapeutic agents, in the name itself, it is given immunotherapeutic means which improves, which enhances the body's immune response for recognizing and attacking and destroying the cancer cells. The examples of immunotherapeutic agents includes nivolumab and pembrolizumab. These will act as the checkpoint inhibitors which are used in melanoma cancer, lung cancer, and other solid tumors. So this is about cancer therapy, which includes the principles for cancer therapy and classification of chemotherapeutic agents which are used in cancer therapy. In the next class, we will deal about specific cancers and their pharmacotherapy. Thank you. Jai Hind.